I'm Dr. Yano from Credamcy down in Fort Hood, and I'm presenting Physician Education and Confidence on Breastfeeding Management. There are no disclosures. Both the AAFP and the WHO both comment on how important breastfeeding is for our dyads, mother and infant combos. I don't want to belabor the known benefits to a room full of physicians. However, I do want to highlight the breastfeeding rates that are addressed by the CDC. Initiation rates of 83% of dyads leaving the hospital. However, at 12-month checkups, only 35.9% of dyads are still breastfeeding. So where's this disconnect? We as family physicians have a unique role because we get to interact with them in the clinic, upon labor and delivery, postpartum wards, and in their post-op checks. So there were no previously published studies to address physician confidence in breastfeeding education. Our objective was to assess this confidence in our military family physicians who are caring for breastfeeding patients, and to determine a correlation, if any, to the amount of formal education that they receive on lactation medicine. We used the Omnibus survey at the USAFP annual meeting in 2019. This was an electronic survey program using different forms of questions. This was initially approved by USIS IRB in March of 2016 with annual renewals. We collected information from 05 to 25 March 2019. This survey was in a one live session presentation and then 2 subsequent conference announcements, and then 3 post-survey emails for invitations to complete the survey. Our study population were the 532 USAFP registered attendees at last year's 2019 USAFP conference. Our main outcomes were looking at the confidence level in our physicians on the 5-point Likert scale you see here in initiating of breastfeeding, maintaining milk supply, safety of medications, and radiology studies. We also talked about informal and formal education based on no education, less than 3 hours, 3 to 8 hours, and greater than 8 hours. Our results. Looking at starting breastfeeding, initiation, latching, nursing, timing, we saw that 33%, only 33% of physicians felt fairly to completely confident in talking to breastfeeding mothers. Very similar numbers about maintaining breastfeeding. We did see an increase with talking to our patients about safety of medications. Almost 38% fairly confident and 15% completely confident. Similar numbers for educating mothers about radiology studies. Almost 30% fairly confident and 13% completely confident. So if you look at this graph and we talk about the formal or informal education on lactation medicine, very similar numbers. Another question we asked, in a typical encounter with a new mother, how much time are you spending talking about breastfeeding education? 1 to 5 minutes for a majority of our physicians. Do you have access to a lactation consultant? 63% of our physicians. So then we started looking at what resources people were using. Up-to-date, LacMed, a lactation consultant, a few people using journals. When we analyzed all of this, there was no statistically significant correlation between any of the confidence measures and the independent variables. Our final question was, do you believe that there should be more training in lactation medicine for family physicians? And close to 60% of our study population did feel that we should have more education. Like I said before, 33% of military family physicians in our study felt fairly to completely confident in talking about breastfeeding, starting and maintaining it. And then also, we did see higher numbers for starting medications and talking about radiology studies. So why is that? That's where the resources are. Those are where the apps really help us. Like I said before, we did not see any correlation between confidence and the education or any other studied variables. However, there are variables that we did not study, like personal experience and the amount of patient hours our physicians are seeing. So we did look at some studies that in the United States and Canada talking about educational interventions that improve knowledge and skills. But there was very limited for family medicine. Everything focused on peds and OB residents, but we also see breastfeeding mothers. We also looked specifically in those that said they were from educational units and see if they had any increased confidence because they're the ones educating, right? And we did not see that. So if they don't feel confident with their own patients, do they feel confident educating medical students, residents? That's a topic for another day. I'm going to spend a little bit of time because even though we didn't find a statistically significant correlation between confidence and our independent variables, family physicians still felt like they should get more training in lactation medicine. We also identified some ways that we could do this through more educational intervention using the rapid online resources that people are already using, but in further studies. Of our study were the recall bias because it was self-reporting. We had limited answer choices, and we're limited to uniformed family physicians. So in conclusion, again, we have a very unique role as family physicians to support these dyads. But overall, we don't feel confident in taking advantage of this unique role. I think there is education in lactation medicine for us right now, but we, as a majority of physicians, feel we should have more training in this subject. More research is needed to evaluate our current education and what interventions can be beneficial. These are my resources, and this concludes my presentation. Thank you very much for listening.